Welcome back to the Viva Eve Podcast. We are here today with the one and only Ambra Bryce Carpenter. You're a patient of ours.
Yes,
at Viva Eve. And not just a patient, a fibroid patient.
Yes.
And we are going to talk about a little bit of your journey because I think you have a really interesting take on going from your symptoms to diagnosis to finding us. Can you talk to us about the symptoms that led you to the start of this journey? We talk a lot about fibroid symptoms kind of rooted in our period cycle and heavy bleeding, all this stuff. Yours was a little different. So what was kind of the genesis or the starting point of thinking something might be wrong?
Yeah, I had an appointment with my OBGYN. I was getting a pap smear and I knew that something was wrong because I was having horrible back pain. It was like a spiking pain all the way through my back, especially my lower back. And then when I would use the restroom, it was horrible. And I would feel it every time I would have sex with my husband.
Yes, which is a fun word that we have learned recently. Dyspareunia.
It was horrible. I couldn't even sit up straight sometimes when I would walk around afterwards. And I was like, what is going on? And I had no idea it was going to be connected to my uterus or even that area. I was like, oh my gosh, it's just back pain. And so when I was getting my pap smear, my OBGYN, she could feel them. That's how big they were. And I never paid attention to the bloating that I was having either. I did have bloating. That was one of my symptoms. Yep. But I never saw any major concerns with my blood flow on my period. Okay. It was mainly the back pain that just really alerted me.
I know we talked a little bit off camera about, having a partner and going through this. You just kind of newly married.
Yeah.
What was it like getting there and going through that with a partner? What was his reaction or response to all of this?
Yeah, it was actually so helpful to have him, and honestly, truly a blessing because I was terrified to come to the doctor and even go through with the appointments, and he came with me. And I appreciated him so much for that support and just being understanding and being on the journey with me. Yeah. And knowing that we do want to build a family and this was something that was going to affect that. And so I think that he kind of took that to heart as well. It's like, I have to protect you and advocate for you for our future family. So having his support was really great.
True masculinity.
Yes. Real men do exist. He came with me to the first 3 to 4 appointments.
So nice.
And it was so nice to have him there.
So you had a different OBGYN.
I did.
That referred you to go get fibroid treatment somewhere else.
Yes.
And what was that process like? Where'd she tell you to go?
She sent me and recommended me to a fibroid specialist that was based at Mount Sinai. Okay. As soon as I get to the appointment, she talks to me. She's like, yeah, you have fibroids. I'm starting you up for surgery next week. And I was like, wait, this is a bit much. It just seemed very aggressive. I didn't have a lot of information on fibroids or the different alternatives. Is this the only route? Do I have to have a major surgery? I've never had a major surgery before, so that was going to be a big decision for me. And I was like, I need more information.
So you go to the hospital.
Yeah.
They immediately try to get you scheduled for surgery.
Yes.
How many fibroids did you have?
I had 13.
Oh.
And one really, really big one. It was as big as a fist, and it was actually sitting on my bladder. So that was the reason why I was having so much pain when I was using the restroom.
Okay.
Yeah, it was horrible.
So you go there. They try to sign you up for surgery right away. You step out. Call someone.
I was like, I'm just going to do my own research. She had talked to me about a myomectomy. So I just kind of started going through my research on Google, just seeing what fibroid specialists were in New York. And I was like, I'm in New York City. I know that there has to be other options and other specialists. And you guys came up on Google and I was like, let me look into this. I sent it to one of my friends who's an RN and she was like, they look legit. You should go to an appointment.
That's awesome.
So I scheduled an appointment and did an initial introduction and I just kept going ever since then.
Yeah, stayed in the process. We do have, for those who don't know, we have concierges who kind of partner with the patient. We also have fibroid navigators, which are nurse practitioners who give that clinical guidance along the way as you see your MD through different, moments in your journey with us. Going through fibroid treatment is not what I think maybe the hospital was going for, which is 1 + 1 = 2 and you'll have surgery next week. Mm-hmm. The approach here is, I think, quite customized. And that can take a little bit longer because the team does like to get to know you and understand your goals.
Yeah.
There's surgical options, myomectomies, hysterectomies. Here, obviously, we have a non-surgical option. It's called, we call the Uterine Fibroid Embolization. Obviously, that ended up being your treatment path, personally.
Yes.
And I know you'd mentioned you and your husband want to have kids.
Yes.
What was your previous doctor saying to you about fertility and fibroids, and what was your perception of the impact and what could be?
Yeah, they didn't give me any information. They told me that I had fibroids and that it was sitting on top of my bladder, and that's where the pain was coming from. And they were just like, yeah, we can do a myomectomy. And I was like, well, what is that? And they were like, yeah, this is going to kind of remove them, but they can potentially grow back. And so I was like, well, what are the benefits of me doing that? And are there any other options? Is there a diet that I can do? Where do these come from? Like, I just had so many questions. And they were just like, oh, no, it's not a big deal. They're not going to harm you. It only changes your lifestyle, but it's not a big deal. I kind of felt like they downplayed it a little bit.
Like lifestyle is not a big deal.
Yeah. And so when I came to Viva Eve, I was really grateful because they walked me through the process, and like I got a chance to do an MRI and actually see where they were in my body. Big deal. I never had an MRI, and they were going to sign me up for surgery. I'm like, you guys don't even know, and I don't even know what it looks like inside of my body. So I'm so happy that they took the diligence and like really went through and understood my body.
It is a partnership, right?
Yes, it is.
You're the one who has to show up every time for an appointment, go to the MRI, go through the results, get on the schedule for your procedure. Yeah. And the procedure, we should say, you are under a anesthesia for it, but it's not major surgery. It's like a little incision, right? I can't even see it anymore. It's gone. It's wild.
There's an incision right here. I literally only had one Band-Aid when I left the hospital.
You're like, you don't understand. I had a busy day.
I just came out of surgery and it's like one Band-Aid. But yeah, you can't even see it anymore. I followed all of the instructions. I felt very comfortable going into the procedure. They really briefed me beforehand and made sure that I had everything prepared at home, what I was going to need to do as far as like diet and not eating and prepping my body for the procedure. So I had a really good experience.
Awesome. Now, going back to the fertility thing, there's always a concern around, and patients will ask this, we have followers that ask us this, around a UFE, a fibroid embolization, and preserving the uterus for the future. Did Dr. Gohar talk to you about that? And if there was risks involved, what kind of helped you get to that decision to go with the UFE?
Yeah, UFE was going to be the most low impact for fertility. And luckily where my fibroids were placed, I was able to get the UFE procedure.
Got it.
And they were able to discover that through the MRI. So again, knowing what my body looked like and having those options. But I chose to go that route as well because it only gave me a window of waiting 6 months before even thinking about building a family. Whereas with a myomectomy or a hysterectomy, you can't have children anymore. But with the myomectomy, you would have to wait a year.
Oh, interesting.
So the healing is very different from each procedure as well. There's also a very small window of when you have a myomectomy, try to get pregnant, and when they may potentially grow back. Mapping all of that timing, I was like, okay, we're not exactly ready to have a child yet, but I also don't want to feel rushed, right? Yeah. And so the UFE just seemed like the perfect balance for us for timing and family building.
The location of your fibroids is a big deal. Yeah. And I'm glad that you shared that. We do have some questions from patients, followers, viewers that are super concerned with the UFE and fertility, but it's kind of like at the end of the day, without the education of your provider being educated on your fibroids, you being educated on your fibroids, you never know what's possible. This is one of the reasons why we wanted to bring patients on to talk about their very, very poignant and specific instances, because it just goes to show everybody's body, everybody is different. And the more options I think that women can know and learn about, the better. Have you personally, shared it with the women in your life?
I have.
What has that been like when you were either explaining this to them or what were those conversations like?
I was so surprised at how many Black women actually have fibroids that I did not know. Women that are around me all the time, older women, younger women. And so when I was telling them like, oh, I'm preparing to, have a procedure, I have fibroids, they're like, oh, I had fibroids. Oh, I did. And it's kind of this thing that they're just kind of like brushing off because it's been brushed off by doctors. Like, it's like, yeah, you have a myomectomy. It's fine. There's like not a lot of options. There's not a lot of research around it. And so I think that they just kind of like have downplayed it and just like pushed through to figure out what works for them.
Yeah.
And even hearing from some women that have recently been pregnant and chose not to have a myomectomy and carry with the fibroids has been really interesting to hear that. And like women that have had to have multiple myomectomies. And so it's just so interesting. Even talking to one of the older women in my life, an older aunt, she had a procedure in like the 90s and she's just like, I can't believe you were able to get to that.
It's like magic.
It's amazing. Really so cool. It's surprising how many women have it and how it's such a like silent thing amongst Black women. And so I'm happy that you guys invited me here. And I've even been happy to talk to my friends even more and just sharing your social accounts. There's even more information on there than there is anywhere, especially with major hospitals.
It really is about awareness.
Yes.
And, you know, with previous generations and I mean, the stats are real. It's like, I think it's up to 70% of all women will have a fibroid at some point. But because it's not like a killer, right? They're non-cancerous.
Lifestyle.
But it's just a lifestyle, as if like that isn't like our whole life. It's just kind of like, just deal with it. You deal with pregnancy, you deal with period pain, you deal with all of it. It's like another thing that we just kind of have to, very big jagged pill to swallow. So I'm just happy that you stuck with it. I mean, it's work.
Yeah.
It's work. Going through fibroid care. I've been through IVF. I mean, it's kind of like having a little part-time job.
Yeah.
Dealing with this stuff. I'm so happy that you went through it. You did it.
Yes. And I'm so happy that I had the support. I'm really grateful for this facility. And I've been telling all of my friends about it. And even if they're in other states, it's like, just go on their page and like look at the information just so that you can be informed. Because there's just not a lot of practices that are even providing options.
Yeah. New York is I think, doing a pretty good job at showing up for women with fibroids. I feel for the women who are in other parts of the country where this just doesn't exist.
Yeah.
And obviously they can travel and everything, but not everyone has that option.
Yeah.
So, so we're going to keep on keeping on.
Yes.
And just to give a little plug, are doing something really cool. We have to talk about it real quick, guys.
Yes.
Because it's Women Celebrating Women. Ambra, you are the new marketing head for an Olympian.
Yes.
What is her name?
Raven Rogers.
Raven Rogers. She is a
Nike Olympian. She's based in LA.
So cool.
She runs the 800-meter track and field.
Oh my God.
And she is going to be under my agency, Cedar Street.
Yes. Yeah. And then you get to go to the Olympics and come back and tell us all about it.
Yes.
In 2028. What year is it?
It's 2025.
Oh my God. Okay. So we got time.